Saurav Sharma recorded this message after spending a month on a ventilator. He needed a medical device to help him speak, but it was a major milestone in his COVID-19 recovery.
32 lakh ka.
However, as his condition improved and he returned home, his family faced another dilemma: paying off the $50,000 in medical bills. After spending all their savings, they borrowed from friends, family, and the bank. Still short, they turned to a popular fundraising site and raised $30,000. Since Saurav is still unable to walk or interact with people, his family has rented a separate home for him with 24-hour care.
Financially,
Financially, we lost money because of the medical bills. We lost our incomes and had these new expenses. On top of it, we have interest on loans. It was a very horrible experience. I used to feel like I had almost lost my son. Almost every day I used to feel that I would get the bad news.
Most Indians don't have health insurance. Faced with a mountain of debt due to COVID-19, thousands sought help online and have collectively raised nearly $200 million since the pandemic started. During the record-breaking second wave, online donations increased fourfold.
This was a collective struggle and empathy has only increased. And luckily, because of the digital penetration right now, in the internet penetration in India right now, through social media, we become more aware about what is happening.
India spends less than 2% of its GDP on healthcare. And as public hospitals became inundated during the peak of the second wave, many people were forced into private care. And the cost of life-saving drugs and medical equipment in short supply also shot up.
Government has been for the last 20 years, but definitely in the last 7 or 8 years, having an active process of encouraging markets in healthcare. But when the COVID-19 came on, the private sector completely failed to rise to the occasion. In the beginning, they shut shop. Later, when they opened, they were charging high.
In a bid to restart the economy, restrictions have eased across the country. But the lockdown has pushed millions into poverty. With the threat of a third wave looming large, many states have made arrangements to increase hospital beds and improve oxygen supply. But experts say that even if the next surge is mild, its economic and social cost will be disproportionately high. Pavni, Mittal, Jazeera, New Delhi.